Okay, so you're looking for a deep dive, right? To understand something important quickly and thoroughly. Well, today let's head over to Papua New Guinea. We're going to explore this idea that improving healthcare can actually be a powerful tool to fight poverty.
Yeah. You know, looking at all this material, what really jumps out is how closely linked poverty and poor health are in Papua New Guinea.
Right.
It creates this tough cycle, and when people get sick, they can't work, they lose income, and then they have to pay for treatment, which makes their financial situation even worse.
Absolutely. So for this deep dive, we really want to understand how improving healthcare can break this cycle and actually help reduce poverty.
Right.
And we're going to do that based on all this information we've been looking at.
Exactly.
Maybe we're going to start by thinking about the logistics, like how do you even get healthcare to people in such a challenging environment?
Well, that's a really good point. Papua New Guinea has incredibly difficult terrain, right? Mountains, remote villages, all that.
Right.
So traditional hospitals, they're just not accessible for a lot of people.
I see.
And that's why expanding mobile clinics is so crucial.
So these mobile clinics are kind of like healthcare on wheels, right?
Yeah, exactly. Think of them as units equipped with, the basic tools, but really important stuff, like simple blood tests for things like malaria, vaccines, of course, and essential medications,
Right.
bringing help directly to the communities that need it most.
Gotcha. And what kind of impact are we seeing from these mobile clinics?
Oh, the impact is huge. I mean, by providing preventative care and early treatment, for diseases like malaria and pneumonia, we can stop minor illnesses from becoming these big financial burdens for people.
I see.
It's about protecting livelihoods and, of course, saving lives, too.
That makes a lot of sense. But even with these mobile clinics, how do you provide consistent support on the ground? That seems like a big challenge.
Yeah, absolutely. That's where the training of community health workers comes in.
Okay, so explain that.
Well, you see, there's a serious shortage of doctors and nurses in Papua New Guinea, especially outside the cities.
Right.
So training people within their own communities to provide basic care is a really smart and effective solution.
So these community health workers, they can handle those everyday health issues, right?
Yeah, exactly. They can treat common infections, help with childbirth, share important information about hygiene, things like that.
Okay, so they're like that vital first point of contact for people.
Precisely. And what's really great is that these workers, they're already trusted members of their communities.
Right.
This means people are much more likely to take their advice and use the services. And fewer sick days, well, that directly translates to more stable incomes for people, as we talked about.
That's a great point. Now, another area that seems to have a big impact is maternal and child health. Sadly, the rates of mortality are really high.
Yeah, they're heartbreaking, really. The
Right.
loss of a mother or a child has devastating consequences for families and communities.
Absolutely, both emotionally and economically, I imagine.
Exactly.
So what are some of the key focuses in this area?
Well, a lot of it is about care during pregnancy,
I see.
making sure women have access to those crucial checkups, getting good advice,
Right.
then ensuring safer births, of course,
Yeah.
and making sure all children receive those essential vaccinations through outreach programs.
Right, getting those vaccines out to everyone.
Exactly. And when we think about the bigger picture, when mothers and children survive and thrive, it means families stay intact, they can be productive.
Keeps them strong, yeah.
Exactly. So addressing these high mortality rates, it tackles a major driver of poverty head on, preventing those health crises that can absolutely devastate families financially.
Right, because those medical emergencies, they can just wipe out a family's savings.
Exactly.
It really shows how connected everything is. And it highlights the importance of making sure that healthcare isn't priced out of reach for the people who need it most.
Yeah, that's such an important point. Even basic treatments can be a huge barrier for low-income families.
So what can be done to make healthcare more affordable?
Well, there are several solutions. One is to subsidize the cost of those essential medicines. Another is to establish clinics where care is provided free of charge,
Right.
or providing health vouchers to those who need them most.
I see.
This can really help prevent families from having to make tough choices, like selling off important assets, like land or livestock, just to afford medical care.
Right, to avoid those desperate measures.
Yeah. Affordable health care helps families hold on to their resources and, ultimately protect their future.
That makes a lot of sense. Finally, we have to talk about preventable diseases, which are still a big problem in Papua New Guinea.
Yeah, unfortunately, diseases like malaria, tuberculosis, and waterborne illnesses still have a major impact.
Right, both on people's health and the economy as a whole.
Exactly.
So what are some of the strategies to address these diseases?
Well, often the interventions are pretty straightforward, but they can be incredibly effective.
Okay, like what?
Distributing mosquito nets to prevent malaria, for example.
Yeah, makes sense.
Improving sanitation facilities so people have access to safe and hygienic conditions.
Right.
And ensuring access to clean water through community projects.
So it's a lot about the basics.
It really is.
But those basics make a huge difference.
Oh, absolutely. The direct result is that fewer people get sick, which means they have more time for essential activities like farming, trading, or for children attending school.
It frees them up to build a better life, really.
Exactly. And that, of course, leads to better economic prospects for everyone.
So looking at everything we've talked about, the big takeaway here is that by making healthcare accessible, keeping it affordable, and prioritizing prevention, communities in Papua New Guinea can really empower themselves to overcome poverty.
It's about protecting their most valuable asset, their health.
Exactly.
And I think what becomes really clear from all of this is the undeniable link between health and economic well-being, especially in a place like Papua New Guinea.
Right.
Investing in healthcare, it's not just about individual health.
Yeah.
It's a fundamental strategy for economic development, for lifting communities out of poverty.
I totally agree. And it makes you wonder, if something like ensuring basic health care can have such a transformative impact on communities in Papua New Guinea, what could that mean for other communities around the world facing similar challenges?
It's something to think about for sure.
It really is. Thanks for taking this deep dive with us.
My pleasure.